Welcome to another episode of A Doctor's Journey podcast, navigating life and medicine with coaching and healthcare innovation. And I'm your host, Miguel Villagra. I'm the founder of A Doctor's Journey. That is a digital health consulting and coaching program where we have resources on physicians, entertaining, entrepreneurship, and interested on learning more about healthcare innovation. And today we're going to have an amazing guest that I'm very excited to kind of hear her story. Her name is Shannon Seeberan. She's the co-founder of CloudMedSpas, abbreviated on CMS. She's a devoted client advocate focused on empowering as many aesthetic providers and potential owner as possible. That sounds amazing. She draws from 8 years experience in aesthetic and dermatology consulting that give her insights into corporate aesthetic initiatives, private practice challenging, med spa inefficiency, and the potential of the aesthetics practitioner. As a mom and previous entrepreneur, Shannon is passionate about empowering the many women seeking the financial benefits and control of running their own businesses. Such an amazing story and bio. Shannon, welcome to the show.
Thank you. It's a pleasure to be here. I'm excited to have this conversation with you.
Fantastic. If you're going to tell me a little bit about your background and the different stages of your life, I believe in the power of sharing stories that may be uplifting and inspiring of some of our audience.
Of course, I have a personal relationship to the medical space. Not that I'm a physician myself, but I'm the daughter of a physician who was a private practice owner for many years. So, what drew me into medicine is, primarily as a consultant early on was just seeing a lot of the inefficiencies and practices that increased risk and debt for physicians. And I just believe that we bring a solution to the table that helps solve a lot of day-to-day pain points. It helps physicians and healthcare providers work smarter, not harder. And so, a lot of physicians, especially even in my own family, I saw practices not sort of adjusting to the opportunities and the technology that was made available because of fear of regulation of malpractice. We're in a very litigious, obviously, society. And I want physicians and healthcare providers to really feel empowered by our platform, and then it gives them a true transparent opportunity to think differently about approaching their practice of medicine or how they run their practice, and just give them options.
Fantastic. A lot to unpack in there. Over my journey into entrepreneurship, I came to realize the fact that although we went through these long, extended periods of training as physicians, residents, fellows, etc., oftentimes we don't get that deep into the business aspect of medicine, and that becomes something that I always preach to physicians. There are things that you can learn and understand, or get the people that can help you understand and apply some of those concepts. I think that one of the things that you alluded to, though, is something that we see a lot. Unfortunately, there's a lot of inefficiency and waste in healthcare in general, right? So, and I'm kind of curious to see what pain in private practice first convinced you that you needed to build alternative models to help and fix this issue.
Yeah, I saw, physicians' overhead was always increasing. Insurance margins were a constant fight. And so physicians felt like they were losing control. And sometimes the only solution they felt like they could embrace was having, obviously, a larger conglomerate take control of their practice. Again, they're losing autonomy in that option. So how could we keep the control in the private practice with the private practice physician or the independent practitioner, and empower them to feel that they had an option to continue their entrepreneurship in practicing medicine or moving forward? So, being able to provide that coaching, that support, and the business intellect with our clients to give them an option that they may have considered but didn't know how to implement. Our platform does that for our clients. So it gives them this step-by-step playbook process to consider an opportunity that is different from what they think. They may think they only have, two options moving forward. We sort of break down that barrier and give them other options to practice independently.
I think that's fantastic. I believe that we lost control over the practice of medicine, unfortunately, over the years, and we see acquisition rather than norm in private practice, rather than the exception. And however, I see that there is and I might be biased because I'm in the healthcare innovation space, but I'm very optimistic in the future. I see new models. I see more new ownership, physician-driven businesses that are growing initially independently, and now I see the other way around, partnership with larger healthcare system, bringing specific models that they're building at the local level and trying to scale at the more regional or even national level. So I think there's a lot of technology that is helping us also in this journey. I'm very, again, optimistic on the future of technology, but I'm kind of curious to see how you see your model fit among all these new trends in healthcare.
So, in short, what our model offers is an Airbnb option for space owners, healthcare and medical space owners, or providers seeking a shared co working space. It's a great opportunity for existing leasers or medical space owners to leverage their space to other practitioners, a lot of which are already doing this. But it's either a headache to maintain, a challenge to get other practitioners in the space working successfully alongside each other. Or for that practitioner, it might be the med school student who's fresh out of residency who doesn't want to incur the traditional debt typically aligned with starting your own practice and getting up and going. So we're really solving the solution for all players and providing an opportunity for collaboration, autonomy, ownership, all of which is the end result is the best for the patient outcome. Keeping the control of a physician or a practitioner's opportunity, their ability to make decisions, controlling the best outcome for patient care at the end of the day, as opposed to mergers and acquisitions that take away that decision making from the practitioner, which in theory, the trickle down effect and the impact is the patient. So our platform allows practitioners who want access to space to be able to access it affordably, either on a weekly, monthly, or an hourly basis, on an as-needed basis, work cohesively with other specialties in the same space so that opportunities for referrals, patient acquisition, growth for their own practice is there organically. And it also allows the space owner physician to leverage and be the landlord in theory of that opportunity and leverage exam rooms or underutilized space in a practice, potentially scale a practice and grow a practice without incurring higher risk and overhead as well. So Airbnb is sort of the easiest way to approach what this opportunity brings to the table. We bring opportunities for renters and owners.
Wow, such innovative approach. I love it. So could you just kind of guide me through rather a walk through a potential client from CloudMedSpa, how the process works from beginning through the end?
Yes. So, our primary client, who is the space owner who comes to us saying, you know what, I'm in this specific location. I have 5 exam rooms, 2 of which are rarely used all the time. I'm primarily in 3 of them seeing patients. I think this would be a great way for me to leverage additional revenue to cover my overhead and rent out those other 2 rooms. We obviously, based on the utilization model, we understand from our client how and when they want that space accessed. It is under their control at all times if they want it accessed 3 days a week, 5 days a week, 3 hours a day, 10 hours a day. So they have the control as to which and how many rooms and what times those rooms are made available to other practitioners. What's nice is that our platform is, in theory, the regulatory process with which renters have to complete and enroll in order to be able to access that space. We do not provide the renters for our clients. We help drive awareness and opportunity and leads for our clients. But as you can imagine, your space is your space. It is up to you to show your space to potential renters and be able to articulate the opportunity of using your space. However, we sort of provide everything else in a package, business in a box, for that renter practitioner when they complete enrollment on the app. They're also providing proof of licensing, proof of malpractice insurance, all of the regulatory needs to practice independently so that you as a space owner can continue to move forward, focusing on your practice, your business, without incurring additional liability of users of your space. So the software is primarily a scheduling platform for those users of your space. So you are not managing who's in room A on Tuesday for 3 hours or the whole day. You are not doing that. The platform helps manage the users of the space and how they access and reserve the time. It also provides payment processing, so you are not dealing with that as well. So you are benefiting financially from the leverage and access of your space without incurring liability and dealing with the day-to-day sort of scheduling and management, which typically comes with a lot of practitioners who are doing this in the traditional form.
Interesting. Can you just let's get a little bit more granular here. What would you see as an practice owner who has this room? Let's talk about an example, 3 to 6 room practices. What does underutilization look like, and what a pilot with CMS for the first few months after using it might look like?
So, and this goes back to sort of explaining the branding and the name of our business. The primary model was built to fit the need of a huge marketplace that was in need of space. Those were primarily aesthetic medical practitioners. So CloudMedSpas was derived from sort of this huge movement that we saw of aesthetic medical practitioners seeking the opportunity to be entrepreneurs and work independently. Aesthetic medical practitioners, as you might know, are non-invasive procedures offered by typically RNs and NPs, sometimes PAs. They tend to mostly be focused on the injectable marketplace of aesthetics, so fillers, neurotoxins, and providers offering those non-invasive procedures. So primarily, we were initially creating spaces and space availability to that marketplace that is very quickly growing. The majority of our clients are not typically traditionally, and when I say clients, the space owners are not typically in the medical aesthetics field. They are private practice physicians, OBGYNs, dermatologists, orthodontists, people who have underutilized space that they want to leverage and rent and lease out when they are, and rent out when they are not using their own space themselves. We collaborate very closely with clients on the provider acquisition process and really help streamline that opportunity. The area of opportunity to acquire renters is really in the upfront effort that our clients put forth with us to basically offer the opportunity, show their space, explain the opportunity to potential renters, and onboard initial prospective renters in their space. An average space renter, regardless of what their specialty is, could be renting up to 10 hours a month in a space on an as needed basis. Our average hourly rental price is around $99. So we see the majority of clients utilizing these spaces are typically utilizing them on an hourly basis, not a weekly and not a monthly rental opportunity. We may see 10 to 20% of practitioners wanting a monthly or weekly rental opportunity. As you can imagine, a practitioner who's accessing the space for 10 hours a month could be generating an additional $1,000 of rental revenue for a space owner. And when you have one space owner utilizing a room for 10 hours a month, you could have multiple renters in one room. That doesn't allocate, it's not a one-to-one ratio. You could have multiple practitioners in a space. So imagine increasing and growing your users to 10 potential renters in your space, each generating about 10 hours a month. That is additional revenue you didn't have before. It helps cover your lease payments, your mortgage payments, and your overhead costs. Does that answer your question?
Yeah, totally. And it really sounds like short-term rental rather than long-term rental for sure, as
It
far as the
is.
model goes. Now, how do you vet the practitioners that will rent the space, and how do you protect the host clinic's brand standards of any patient safety they have established for their clinics?
So the compliance and the cleanliness and the hygiene of the space is up to the space owner between utilizations of the room. The process of enrollment via the app for the practitioner who wants to rent the space is obviously fulfills all of the requirements for an independent practitioner to use a medically or health appropriate space. So that process alone, and there's a terms and conditions in the app that is agreed upon by the renter who is completing that process. That liability is completely owned by the renter and the user of the space, whether they have medical director oversight, whether they are a physician themselves, and their proof of insurance as well. So because the owner of the space cannot see who the patients are and is not able to see the records of the patients or even the bookings of the patients, they are completely HIPAA compliant as a renter of their space. So it's obviously providing them the liability freedom to be able to leverage this opportunity.
Got it. So now, the CloudMedSpa is nationwide available or is regional dependent?
Yeah, right now we are in 17 markets, which means we have space owners, medical and healthcare space owners in those markets. We are obviously always growing and we're growing very quickly. We see now not just obviously we started out as primarily our primary space renter was the aesthetic medical provider. And now we're seeing a whole diverse array of specialties accessing our space. Concierge physicians, nutritionists, obviously nurses, many different specialties who realize, and as we all know, post-pandemic, the need for space and to have your own space versus a shared space or space as needed when you're seeing patients, that the healthcare marketplace is a lot more flexible now. And so the need to have your own brick and mortar and the overhead that comes with that is no longer necessary for all specialties, right? So being able to share appropriate medical space and to use that space, especially for physicians just starting out in private practice, and to be able to access the space they need and grow their patient list, and be efficient with how they're seeing patients in person versus telehealth. It's really helping them work smarter, not harder. And we also see clearly a lot of physicians waiving the insurance opportunity and really cleaning up, making their process of seeing patients and treating patients a lot more cleaner from their perspective.
Got it. So let's take a detour into what I call physician playbooks. I like to kind of get granular on tips that you might have. Like if I'm a practice owner, have a couple of rooms available that I can lease. If you want to consult me, what areas should I focus the most if I want to get started? Like whom I'm going to be renting the space to, the malpractice coverage, any subleasing rules, any specific supervision that you need to for these clients. What would be your tips, practically speaking?
So we help you with initial market awareness when you come on board as a client, which generates typically interest from 20 to 30 new potential renters a week. That doesn't mean they're all signing up, but they're interested in a co-sharing shared space opportunity for running their practice, whether it's aesthetics, whether it's and any other specialty in the healthcare arena. So once we start generating that traffic help you generate that traffic for seeing your space, we encourage you to set up specific times to show your space. All practitioners want to see spaces where they're going to begin using and treating their patients. So we help you with understanding how to articulate the cost for your space to potential renters and the opportunity and the flexibility. People want flexibility. And for a practitioner to understand that they could potentially use your space 2 days a week or 2 days a month and practice at another location a few days a month, the opportunity for them to expand their patient base amongst many different areas in a specific marketplace by leveraging CloudMedSpas locations as opposed to only staying in one location is what we've noticed a lot amongst practitioners and members of different CloudMedSpas locations. They want the flexibility to be multi-location practitioners without being the leaseholder. And so it gives a lot of flexibility. So we provide, and then the practitioners who are using your space, we provide them with the support they need to onboard through the app and complete that process so that obviously reserving and renting the space through the app is very streamlined and easy.
So now, if we do a physician fit test, who should not do this and who is the ideal fit for CloudMedSpa?
I would say physicians who are primarily focused on and who are insurance-based specialties who are still, they may need more support from additional staff in order to run their specialty, right? So this is really a great opportunity for physicians who are working independently, who are not incorporating insurance into their specialty and working outside of that bandwidth and can work independently and leverage these spaces in that way. When physicians need extra support staff and opportunity and staff members in order to manage and control a patient experience, that's when a one-room opportunity doesn't make much sense for a specific specialty. It does make sense for physicians who are already lease owners or space owners to leverage and utilize their space for more users and offset and subsidize their existing overhead. So for the space owner, it makes sense for any and all space owners to access our platform and be smarter about their largest asset, which tends to be their space. For the renter and the physician seeking space, this is great for the new physician right out of medical school who's trying to find their sea legs, figure out how to grow their patient base, only access space and pay for space on an as-needed basis, as opposed to incurring that debt, purchasing a practice where not necessarily the patients will stay with you when another physician retires or leaves. It's an opportunity to start your independent practice without incurring more overhead and debt.
Now, how the process works to get started with CloudMedSpa? You do initial assessment of the practice of the space. Is this a trial period? How the process go?
No, it's a very simple process. We can get you up and running within a week's time. So it's very easy. Typically, I have a one-on-one conversation with a prospective client, our client being the space owner, and to see, what their space is like, where they're located, to understand the availability of their space, and walk them through a financial projection as to what this could mean financially for them, as far as incremental revenue coming into them by other users of their space. It's also helpful to know who their network is based on their specialty. if this potential opportunity could help them organically expand their patient base, there's a lot of opportunity there as well. So more diversified users in a shared space, medical space, often increases the referral opportunity and growth of every physician or practitioner in that space as well. So it's very simple. Typically, I recommend to prospective clients, let's set up an informational call so I can learn more about your space. If they're interested in obviously accessing our platform so they can begin to onboard renters and provide this opportunity at their location, it can happen quite quickly within a week's time.
Interesting. Now, do you have an example of clients that you have in both parties, either as the renter or the one that is the rentee, and outcomes that you have see happening?
Yes, and we share those financial outcomes with all of our clients, but I think from a financial outcome, I gave you an example primarily. We see an average renter churning about 10 hours a month. 90% of our renters want hourly access. They do not want to be restricted to a monthly or weekly term. They only want to pay for space when they're using it, which gives them a lot of control and autonomy over costs and overhead. If a practitioner is not in your space for a month, they're not paying lease or rent. If they come in for a week, they could pay you a weekly fee. So it gives you as the space owner a lot of flexibility for not having one or two renters, but for having 20, 30 renters using your space at different times, different days of the week. And so that we do see a blend of different practitioners using this space. As I said, the majority of practitioners in the marketplace looking for this type of space and this autonomy tend to be in the healthcare and beauty space, offering those procedures. It doesn't mean it can't apply to a periodontist who wants to see patients on the opposite side of town one day a week and do her consults at a location there without paying and signing a lease at a new location. Or it doesn't apply to the concierge physician who typically does the majority of his consulting through telehealth medicine, but from time to time may need to see a patient in person. So there is more flexibility to different specialties in medicine that is giving them more control as to when they need to be in an office. So as you can imagine, when we onboard a client who is a space owner, we help them reach all of those target audiences and drive traffic and awareness to their space now being a shared medical office space opportunity. Does that make sense?
Yes, it does. Now, the model so far you have seen it feed on what type of location, either smaller settings like small cities, larger suburban areas?
Suburban and urban areas have thrived very well. Extreme rural locations tend not to do as well, as you can imagine. You want to be in areas where there are lots of practitioners, right? So this is not relevant to who the patient or client is. It's relevant to where there's a healthy, I would say, dense amount of practitioners in a location. For example, we have a location in central Boston, that is basically in the hub of all the teaching universities, medical universities. So we clearly have a lot of visibility there by different practitioners who are in walking distance to that location. And so, we are not a franchise company. And so we don't restrict locations from being near each other. We believe that there is enough demand in this marketplace that you could have a CloudMedSpa location down the street within 5 miles of another location, because the acquisition of leads and renters truly stem from the space owner and the proximity and the opportunity for practitioners to be multi-location renters and practitioners at different locations. People are looking for more, of a variety of places to work.
I see. And to access the platform, you pay based upon a percentage of the people that you rent the space to, or is a fixed cost that you kind of charge on a regular basis?
So our clients who own the space, they pay what's a one-time setup fee for us to add them to the platform, and that's $1,000 one time. Going forward, there's a $99 subscription rate, which obviously gives access to all of our technology and how our app is evolving for our clients specifically. Primarily, we do also support renters who need access to prescription aesthetic medicine, the injectables we discussed prior. So for renters who need access to injectable medication, they can also get access through the platform for those products. So the process is very streamlined and easy. And so there's the monthly fee, there's a one-time setup fee, and then we work very closely with our clients as to what they want their weekly or their hourly fees, rental fees to be. So we give recommendations, but at the end of the day, that fee is up to you. CloudMedSpas takes a margin of 15% of the gross rental revenue. So for every $100 an hour you're renting your room, we get 15 and you get 85. If our clients are not successful for renting their space, we don't make any money, right? So this is truly based on success metrics. We want our clients to succeed. We want them thriving with renters and users of their space.
Got it. Do you have any tips for any practice owner like that is considering the service? What would be how did they feel encouraged to go ahead and move forward with using it?
Well, the cost of entry is really low and risk is low based on all of the overhead and expenses you're currently incurring from having your own space. To be able to tap into an opportunity that generates additional revenue for your largest asset, this is a low risk opportunity for $1,000. And you could begin generating incremental revenue to subsidize your overhead, your lease payments, your mortgage costs, your front desk employee immediately. So this opportunity can bring users to your space that are generating revenue for your practice, for your overhead immediately, and the cost of entry is very low.
Got it. Do you have any last message for the audience, people that is interesting? And also tell me what people can reach out to you. Where can they find you?
Great. Yeah. So, I mean, what I would say is, work smarter, not harder. There are opportunities to leverage the technology that's made available to you now that can help you continue to control and have autonomy over your practice. We have already seen so many clients benefit from this opportunity. They have scaled and added second locations to their practice because now they have a means with which to offset their overhead costs by having other users of their space. So I always encourage anyone who is interested to set up a time to talk with me. Let's talk through it. Knowledge is power. Let's specifically talk about the metrics of your location so you have a full understanding of this opportunity where you can decide to move forward or not. The best way to reach me is via email, which is my first name, Shannon, SHANNON, at CloudMedSpas, and that's plural.com. And our website, CloudMedSpas.com, is a great resource for learning more and understanding both the space owner experience and the renter experience and how we really coach and support our clients in the entire process. This is not a transaction where we set you up with software and we leave you to figure it out on your own. We have a team of people that are always available to support our clients and make sure their locations are thriving, doing well, and generating the awareness and leads that they need.
Thank you, Shannon. This is amazing to know about what you're doing. I think it's very innovative and it can create additional stream of incomes for a private practice owner, which I love and definitely help them scale. on their businesses. So thank you for being in the episodes. And for everybody out there that want to reach out, we're going to add her contact information on these week episodes. And we will see you until next time. Thank you.
Thanks, Miguel.
Bye.
Bye.